Hey everybody, my name is Dr. Daniel Choi here from North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center, and I wanted to talk about the most common misconceptions with dental implants. So you might be wondering, all right, there's probably tons of videos out here on YouTube talking about, misconceptions or anything to do with dental implants. So why should I be listening to this guy? Just to give you a little credentials about myself, this is my current 11th year of practice. I am a board certified periodontist. I'd like to say that probably periodontists are going to be the most skilled surgical specialists in regards to placing dental implants. We go through at least a 3-year residency. And of course, after that, we do become board certified periodontists. So just want to let you know, those are some of the credentials, and in my practice in the last, again, this is my 11th year of practice, it's really hard to say, placed somewhere between about 5 to 10,000 implants. So hopefully I can give you some really good information in regards to what the most common misconceptions are with these dental implants. So let's start here from the beginning. Okay, so first and foremost, dental implants are only the titanium screw embedded in your jawbone. So when I show you this right here, we actually have a fake tooth in here, and that's actually the middle one, the dental implant. But what we see here is that just this part, the titanium screw embedded in your bone, is the dental implant. This on top of it is what we call an abutment, and that screws into the dental implant, and then the crown goes on top of that. So this whole thing sometimes gets mislabeled by the general public in regards to having a tooth or a whole set of teeth is mislabeled the dental implant. Unfortunately, again, it is just this screw, and the reason I bring it talk about this is that then leads to common misconceptions about cost also. So point number 2, I said dental implants can be used as a support for a single tooth, multiple teeth for a dental implant bridge, or support for implant denture. So what am I talking about? So that dental implant right here, again, that titanium screw can be used to, again, like in this model, support a single tooth. It can be used to support a dental implant bridge to replace multiple teeth, as you see right here. So you'd see 3 teeth off of 2 implants. You can have a whole row of teeth off of several implants, and this whole lower jaw is being secured in by those 4 dental implants. And again, I have other models here. This is very similar. This is a 5 dental implant supporting a lower arch. This is permanently screwed in. If you smiled or were to function on this, no one would ever know that those are teeth supported by dental implants. You also have dental implant dentures being supported by a dental implant. So this is a removable device that the dental implants actually help secure that denture. So that's just, again, another example of how dental implants are used for a variety of options. Again, the dental implant is just a titanium screw, but it is the foundation. I always use house analogies all the time. So it is the foundation upon which you want to build a single tooth, multiple teeth, or like a whole arch of teeth. Okay, so I was alluding to this earlier. Because of, point number 3, because of this, the cost can vary widely from a few $1,000s to fix a tooth to tens of thousands of dollars to fix your entire mouth. So what am I really talking about? Let's see over here. The reason why that cost can vary a lot is, again, with my model here with just that titanium screw, just so there's no misconceptions, when you're paying for a dental implant, you need to be very cautious and know about any hidden charges that you might get hit with later on. So again, the cost of the dental implant. And then later on, you're going to have to also pay for the cost of the abutment, and then also the cost of the crown that goes on top of it. Because without the abutment and the crown, I mean, you have no tooth, right? So what's the point of having a screw hidden in your jawbone that nobody can see if you have nothing on top of it? Similarly, when we go with this example here, what would be the cost of the bridge, these 3 teeth that are resting on those 2 implants? And underneath that would be what we call the abutments. So what would be the cost of the abutments in the bridge? And this, what would be the cost of this arch of teeth right here, right? And then the attachments that you can't see underneath here, on top of the cost of dental implants. And then over here, what would be the cost of this prosthesis, these little insert locator attachments, abutments. Again, those are things that you need to make sure that these are good questions to ask when you go speak to your surgeon in regards to getting your dental implants. So on to the next point. The cost, point number 4, this cost may not include bone grafting, which may be necessary or not. So, with my example earlier, I was talking about, a lot of times when I'm in a patient with in a consultation with a patient, I am talking using my house analogies, right? So I like to tell people again, the foundation is your dental implant, and what goes on top of that, or here in Texas, we have foundation issues. So I'm originally from Ohio, but moving down here, I heard about, pier and beam foundations. So, what are these piers? What's supporting your house on top of it? It's actually the dental implants, right? So sometimes we might not have adequate enough bone around our dental implant to provide a nice solid foundation. And I'll create a video that later goes up more in depth talking about bone grafting, why you might need it, what types of bone grafting there are. But bone grafting may be necessary, I would say, in a majority of cases of dental implants. So that cost associated with the dental implant might actually not include the cost of the bone grafting that may be necessary. So that's another question that you need to ask in regards to getting a tooth replaced or multiple teeth replaced. And then point number 5, dental implants can take a day to see the results in your mouth or can take many months. And not every case can achieve results in a single day. So I like to tell patients this is probably a very common misconception out there. A lot of patients are asking me, hey, I saw something on TV, it's talking about teeth in a day. Teeth in a day is usually regarding to something called all-on-4, something like this where you have multiple implants. We can take out your existing teeth, or if you're in a current denture, we can place multiple teeth, take some teeth out also, and then maybe secure a prosthesis in that same day. There are certain cases where that can't go in that same day, so I like to tell people a lot of times teeth in a day, where people get this misconception that you can go into see your surgeon and it's like, they might tell you, well, we need to take the tooth out, do a bone graft, place, wait several months, place the implant, wait another a few months, and then put a crown on top of it. That is probably the most common misconception, because that's probably the course that you have to go through most of the time. There are cases where we could, again, take a tooth out, place an implant, put a crown on, abutment and crown on top of there from day one. Those are cases that are definitely few and far between. So I like to tell patients you have to go in for a consultation, and every case is very case specific. So. And the other thing too is you got to understand, some people may tell you something to keep, make you happy, and it's a little, again, about marketing magic versus doing something that's right for you. So hopefully these questions, these going over some of these common misconceptions were helpful. If you guys have any questions, please feel free to give us a call, come on in for a consultation. Thank you very much.